My name is Lily Seibert. This is my presentation on aphasia. Aphasia is a language disorder that affects a person's ability to understand, produce, or use language due to damage to brain areas responsible for language processing. Aphasia is caused by damage to the brain, like a stroke, head injury, brain tumor, or neurodegenerative disease such as Alzheimer's. Symptoms of aphasia can vary depending on which location of the brain the damage has taken place in. Some symptoms may include difficulty reading or writing, understanding written or spoken language, and producing speech. Other patients may experience issues with grammar and syntax or sentence structure, and a reduced ability to communicate with others. For my article discussing aphasia, it was titled "The Past and Future of Activity-Focused Treatment." The article focuses on research done by Dr. Audrey Holland and the activity-focused treatment for patients with aphasia. The activity-focused treatment uses a person-centered approach. It has 3 criteria of specific goals, an activity that is personally relevant to the patient, and using a real-life setting, whether it's actually real-life or a stimulated real-life setting. The treatment approaches include contextualized treatment, decontextualized treatment approach, and quasi-contextualized treatment. It follows 2 principles of specificity and salience. Specificity means that it is being practiced in a real-world setting, and salience means the activity is personally relevant to the patient to enhance brain adaptation. The application of activity-focused treatment, it can be used with any patient who can preference an activity. Because the activity must be personally relevant to the patient, it is crucial that the patient can preference what is important to them and what is not. The treatment can be measured in direct or indirect treatment effect and by using generalization. Direct treatment effect measures the target-dependent variable, which is stimuli that have the same characteristics and are treated, untreated, or minimally exposed. Indirect treatment effect is a formal or informal assessment measure, such as a standardized test. This type of measure is least effective in demonstrating a change in activity-focused treatment. And generalization is important for other communication situations and maintenance of treatment effects beyond the end of treatment. For future research regarding activity-focused treatment for those with aphasia, there can be more studies done on neuroimaging to view therapy outcomes. Additionally, there can be more studies done to view treatment effectiveness, training techniques for clinicians, and client characteristics for who will benefit from this treatment. What I've learned from aphasia about this article is that there are many different ways to treat it, but the activity-focused treatment is one that could be beneficial to many patients. It allows for good generalization to other life situations beyond the end of treatment and can be beneficial to many different patients.